dog head off. Because you're slowing it down. I want to get home to my dogs, just like you want to get to home to what you want to get home to. So nevertheless, we're going to get this party started. Since it's your first time, please note that even we're going to be doing a lot of learning on the video, we're going to do a lot of practicing on the mannequins as well. I always tell them if you are attentive in this session, it is very hard to mess this up. Possible, but very hard to mess it up. So nevertheless, let's get this party started. We're learning about basic adult BLS. You're going to be nice with that, right?
Check to see if the person is responsive by tapping and shouting. If they do not respond, activate the emergency response system and get an 8.
We'll do that again.
There are several steps of BLS that you'll need to perform when you suspect that a person is in cardiac arrest. First, scan the scene to assess safety. Then, check to see if the person is responsive by tapping and shouting. If they do not respond, activate the emergency response system and get an AED, or send someone to activate the emergency response system. Next, check for breathing by watching the chest for rise and fall.
Abnormal breaths are common in the first minutes of a cardiac arrest. These abnormal breaths are called agonal gasps and should not be confused with normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR. Seizure-like activity can also sometimes delay the recognition of cardiac arrest.
If the person has no signs of responsiveness, the emergency response system has been activated with an AED on the way, and there are no signs of breathing or pulse, then immediately begin CPR starting with chest compressions. The delivery of rapid, strong compressions is a priority, but be sure to deliver ventilation as soon as the pocket mask or bag mask device arrives. Once the AED arrives, it is important to use it immediately. We will go over proper AED use later in the course.
You never know what situation you'll face or what resources will be accessible. It's important to have the knowledge and framework to provide high-quality, life-saving CPR, regardless of the conditions and circumstances.
Now, we will focus on the individual skills that rescuers perform. It is most effective to perform CPR as a team, but to be an effective team member, you'll need the individual skills of CPR. So, we'll start there.
As a healthcare provider, your first step is to assess the surroundings for safety. Then, tap and shout to see if the person responds. If not, you should shout for nearby help or activate the emergency response system in your workplace. Check for breathing by scanning the person's chest, looking for chest rise. Check for a carotid pulse. The technique of feeling for the carotid pulse is usually easier to perform on the side closest to you. Use 2 or 3 fingers to locate the person's trachea, and then slide your fingers into the groove just to one side of the trachea.
You can scan for breathing and check for a pulse simultaneously to minimize time before compressions. The check for breathing and pulse should take at least 5, but no more than 10 seconds. If you observe no breathing, abnormal breathing, or only gasping, and you do not feel a pulse, ensure that help is on the way and start chest compressions immediately.
Before you start chest compressions, make sure the person is lying face up on a firm, flat surface. If you need to remove clothing to expose the person's chest, do it quickly. You need to work with a bare chest because later you'll attach the AED pads to bare skin.
By starting compressions, you are initiating the CAB sequence, or compressions, airway, and breathing sequence. In the first few minutes of a cardiac arrest, there is still oxygen in the bloodstream. Starting CPR with chest compressions can pump that oxygenated blood to the brain and heart. After you give compressions, open the person's airway and deliver breaths. It's important to minimize interruptions in chest compressions to 10 seconds or less. Each time you stop compressions, the blood flow to the heart and brain decreases significantly. When you resume compressions, it takes several compressions to increase blood flow to the heart and brain back to the same levels. So any interruption in chest compressions can result in low blood flow and minimize the chance of ROSC.
To begin, place the heel of one hand on the center of your mannequin's bare chest, over the lower half of the breastbone. Place the heel of your other hand on top of the first. counting out loud, making sure the compressions are at least 2 inches or at least 5 centimeters deep, and allowing the chest to recoil after each compression. We recommend using a feedback device that provides real-time corrective feedback on CPR quality regarding rate, depth, and chest recoil, not just when performing CPR in practice, but also in your workplace. We'll talk more about feedback devices throughout the course, and we will complete some practice and testing with them later.
You can follow along with what's on the screen as you perform compressions yourself. You'll perform 3 sets of 30 compressions after you assess the scene. We'll pause here while everyone gets into position.
Alright, so I want to backtrack a little bit. I want to cover scene assessment a little bit more and then get into compressions. So, first thing to keep in mind, I always tell people, scene assessment is not technically CPR, it's determining whether you need to perform CPR. So with that being said, there's a couple of steps. I always treat it like a video game, even though it's nothing to play for about CPR. But it's kind of like a video game where you got to get past level 1 to get to level 2, get past level 2 to get to level 3. Same thing applies with scene assessment. So with scene assessment, the first thing you're going to do is check the scene and make sure it's safe for you to be in. If it's not safe, stop. Meaning if there's a fire around the person, I know that's kind of out of a movie, a little bit unrealistic, but nevertheless, if there's some situation where it's going to be more dangerous for you to get in, just stop, call emergency services, don't put yourself in that situation. Because the worst thing that can happen is you put yourself in that situation, now we got 2 people to deal with. But let's say you get past level 1, it's safe for you to be in. The second step is going to be giving the physical and the verbal. Hey, you okay, you okay. There's a slight chance they might respond. I've ran gyms for going on 16 years now. There's tons of times that I've walked into those locker rooms and there'll be like a guy laying on the bench with his eyes closed, and I'll walk up to him, hey, you okay? And usually they'll open their eyes up, yeah, I just got a little bit dizzy, I had a hard workout, maybe it was a leg day. So keep in mind, it is very possible that when you get that tap, hey, you okay, you okay? They might open their eyes, yes, I'm okay, I just need a second. But let's say hypothetically, they do not respond. That does not mean they need CPR. All you know is they haven't responded to you. That doesn't mean they're not breathing. So at that point, you need to determine that. So to have it determined is you're going to take your finger, take it to the side, you're going to check their pulse while watching to see if their chest rises up. Because keep in mind, they may have a weak pulse. I actually have a weak pulse. A lot of times when I go to the doctor, they cannot feel my pulse. So that's why you're also doing a visual by watching to see if the chest rise up for 5 to 10 seconds. And then, once again, there's a chance that they might have a pulse. Now, even if they have a pulse, you're still going to call 911 because they did not respond to you. So there is a problem. But that means you do not have to give compressions and breaths. But let's say you check for a pulse and there is nothing, you are going to notify a person. Call 911. You get an AED. Notice that I actually pointed out people. You need to point out or differentiate people. You in a blue shirt, call 911. You in a green shirt, get an AED. The reason why you want to do that is a lot of times what ends up happening is somebody yell out, call 911, get an AED, and everybody thought everybody else did it. You see a whole bunch of people with their phones, and you're like, oh, somebody's calling. No, they're not. They on TikTok, they about to get their lights up. They about to stream because we going live. So you want to designate specific people to do these tasks. Then after that, you can start your compressions. So I want to, even though that took about 5 minutes to explain, it's very quickly to go through scene assessment. Checking the scene, making sure it's clear. Hey, you okay, you okay? Checking the pulse, 5 to 10 seconds. Call 911, get an AED, and start CPR. Once we get into compressions, hands are going to interlock, you are going to be completely over the chest. Do not get slanted. I see a lot of even my experienced people that went through BLS, CPR doing this. They'll compress like this. I am doing a quality compression, meaning I'm going 2 inches down, but this is still incorrect. You're supposed to be completely over the chest so your body weight does it. keep in mind, one thing I want to point out to you guys, in a real world situation, you literally might be doing compression. You gotta see, you literally might be doing compression for up to 5 to 10 minutes. That's why it's important, arms are straight out, because keep in mind, you're doing compression for 10 minutes, let's say that's how long it takes for paramedics to get there. You're talking about over 700 compressions. That's why you want to have your body weight completely over, so it'll make it easier to bounce off the chest. But also keep in mind, that's why every 5 cycles or 2 minutes you are switching compressors if you have somebody else with you. Because it can get exhausted.
So now, let's go through the use of pocket masks, and then we'll practice one rescue skills with compressions and breaths. When you're working, you'll likely have access to a bag mask device. However, because a cardiac arrest can happen anywhere at any time, it's important to be comfortable and effective with a pocket mask. A bag mask device might not be too far away, but when minutes and seconds matter, the time saved by being proficient with a pocket mask is invaluable. We'll use a pocket mask for the one rescue activity in our training today.
When the guard finishes a cycle of compressions, he quickly places the mask with the one-way valve on the person's face. He delivers 2 breaths and returns to giving compressions immediately to minimize interruptions in chest compressions to less than 10 seconds.
Now let's examine the technique. Place the mask on the person's face, using the bridge of the nose as a guide for correct positioning. Seal the mask against the face by placing the index finger and thumb of your hand that's closest to the top of the person's head along the edge of the mask. Now, place the thumb of your other hand along the lower edge of the mask. Then, place the fingers of that hand under the bony part of the lower jaw near the chin, taking care to avoid the soft tissue under the chin. After that, open the airway by using a head tilt chin lift. By lifting the jaw to bring the chin forward, you'll lift the person's tongue away from the back of the throat, relieving a possible airway obstruction. Press the mask down while lifting the jaw to hold the mask tightly against the face, and give 2 breaths while watching for slight chest rise. Actually seeing the chest rise with each breath is the best way to ensure that your breaths are effective. Breaths should be delivered over 1 second each, with just enough force to produce visible chest rise. Avoid excessive ventilation and pause about 1 second between each breath.
In this practice session, be sure to hold the mask firmly against the face while lifting the jaw. Also, watch for the chest to rise as you deliver each breath over 1 second. We'll pause here for you to get into position with the mannequins to practice the technique of opening the airway and giving breaths by using your pocket mask with a one-way valve. We'll practice 5 sets of 2 breaths along with the video.
Alright, let's unravel. So those pocket masks, those are basically barriers. What that's going to allow to happen is when you blow through it, air can go out, but it cannot come back in. Come on over. You're going to place your pocket mask or your barrier into the pocket mask. Skin part goes in, then flip it. There you go. Alright, so when you are giving breath, make sure, you're going to be on the side of your person. You want to put both hands down onto the mask and tilt your head back and then give 2 big breaths. But when you're looking, you should be looking at a slant angle at the chest. You should be able to watch the chest right. 2 big breaths, even bigger. Both hands, both hands, both hands, both hands. Get that right, there you go. Perfect. Come on back up. Hold on to that pocket, that barrier. You will be utilizing it shortly again.
Get ready.
Now let's practice compressions and breaths together by using your pocket mask with a one-way valve. When switching between giving compressions and giving breaths, limit the time between compression cycles and breaths to 10 seconds or less. Make sure the chest rises with each breath, but provide ventilation just to the point of the chest rising. We'll start with assessment and then combine compressions and breaths. We'll be doing 3 sets, 30 compressions with 2 breaths. We'll pause
deep breath. You should see the chest rise up. You're good. Come on over. Scene assessment, compressions, and breaths. Ready when you are. Okay. 5 to 10 seconds.
You get the AED, call 911.
You hit the 911. You get an AED.
5, Take a breath. There you go. One more. Good. Lift the head back. Lift the head back. Take a breath and one more. Good. Come on back up.
When participating in a resuscitation event with rescuers from multiple agencies, the real challenge becomes about logistics. In other words, the coordination of rescuers and resources when more people are involved. However, your first few steps are the same.
When you arrive, quickly assess the scene and try to get a response from the victim. If there is no response, call for help or activate the emergency response system. Then take 5, but no more than 10 seconds to check for breathing, looking for signs that the person is not breathing or is only gasping, and at the same time attempt to find a pulse.
Move the victim to a firm, flat surface and begin CPR. One rescuer should start compressions while the second delivers ventilation. After each set of 30 compressions, the ventilator should deliver 2 breaths. A third rescuer should turn on the AED and attach the pads to the victim's bare chest. It's important to know your AED or defibrillator because models can differ. Follow your device's prompts for the next steps.
When the AED signals that it's ready to analyze and that all rescuers must stay clear of the patient, the compressor should switch roles with another rescuer. While the AED is charging, the compressor should take advantage of that time to deliver a few more crucial compressions.
The emergency responder operating the AED is responsible for ensuring that all rescuers are clear from touching the patient to allow for rhythm analysis and before delivering a shock. If a shock is advised, clear everyone and deliver the shock.
As soon as the shock is delivered, rescuers should begin another set of compressions, with a different rescuer delivering compressions, and with the feedback device now in place. Continue these steps until advanced help arrives.
Now let's focus on using an AED. Although AEDs may differ slightly, there are 4 universal steps for operation. To begin, turn on the AED, open the carrying case or the top of the unit and immediately power on the AED. Some devices will power on automatically when you open the lid. After that, attach the pads to the victim's bare chest. Use the diagrams on the pads for correct placement. Some AEDs may have adult and pediatric pads. Be sure to use the adult pads on anyone 8 years of age or older. If you're not sure of the person's age, use the adult pads. On some AEDs, you may need to plug in the pads if they aren't already connected.
After you open the device and power on the unit, follow the prompts and place the adhesive pads on the person's bare chest per the pictures on the pads. Place one pad to the side of the left nipple and the other on the upper right chest, directly below the collarbone. After the AED is turned on, some units will tell you to press a button for the device to analyze the heart rhythm. Others will analyze the rhythm automatically. The AED may take about 5 to 15 seconds to analyze the rhythm.
a shock is advised, it will charge and then prompt again to clear the victim. You'll repeat the command to those nearby. Loudly state something like, "Everybody clear," and visually check to make sure that nobody is touching the victim, not even the person in charge of giving breaths. Then, the shock can be delivered.
Next, press the shock button. The shock may produce a sudden contraction in the victim's muscles. After the AED gives the shock, resume CPR immediately, beginning with chest compressions. Do not remove the AED pads or turn it off. The device will repeatedly analyze the shock cycle about every 2 minutes. Follow the AED's voice prompts. If at any time the AED indicates that no shock is advised, immediately start chest compressions.
You'll need to consider a few special situations when using an AED. First, if the person's chest is so hairy that the pads can't adhere to the skin, you may quickly shave the area if a razor is provided. If no razor is provided and you have 2 sets of pads, apply 1 set to the hairy chest. If the chest hair prevents the pads from contacting the skin, the AED should tell you to check the pads. If it does, press them down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then apply a new set of pads to the bare skin.
Excessive water on the victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart. If a victim is lying in water, quickly move them to a dry area before using an AED. But if the victim is lying on snow or in a small puddle, you can use the AED. And if the chest is covered with water or sweat, wipe it off before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry.
Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump that's smaller than a deck of cards. If you see this lump, avoid putting a pad directly over it. Also, don't place a pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before applying the pad. If the victim is wearing an undergarment containing metal, be sure to apply the AED pads on bare skin, avoiding contact with the garment.
You should familiarize yourself with the AED model in your workplace. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. AED kits may include additional emergency equipment, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit.
We'll pause here to allow you to get familiar with the AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on a victim.
Providing effect.
Alright. So, before we get to the AED, I want to demonstrate a couple of things with it. The AED, let me just tell you very transparently. For most people, the AED is like the most intimidating component of CPR. I want to give you my honest opinion. If somebody had utterly no experience with CPR, I would be more comfortable with them utilizing the AED than I would anything else. Because scene assessment is a skill. You got to know how to do it, or they die. Compressions is a skill. You got to know how to do it, or they die. Reps, you got to know how to do it, or they die. The AED is not a skill. The reason being is it will walk you through everything you are doing. The only skill you need to have is the ability to listen to it. If you can do that, you're fine. So I'm going to demonstrate a couple things with the AED. The first thing, the most important thing, is listen to it. Now this is something that I tell people, and this is going to sound really weird. You want to know who perform the AED the best? The people with no experience. The best advice I can give you is learn how to utilize the AED, and then after you learn how to utilize it, take all the knowledge out. Because what that's going to do is that's going to force you to listen to it every time. You want to know who mess up the AED usually? Those that are experienced. Because they have all these memorized steps and they skip ahead. And the problem is there's tons of different models of AEDs. So the one you was trained on might not be the one that's in front of you. But if you have all this memorization on the one you was trained on, you're going to skip, you're going to jump ahead thinking, I know how to do this, I know how to do this, and not realize, oh wait, there was a step at this AED required that the other one did. So I always tell people, learn the basic fundamentals left pectoralis because it shows the top left pec, and this one shows the side right rib cage. Just place it where it needs to go.
Apply pad, insert connector, firmly.
Boom. And then insert connection firmly.
Analyzing heart rhythm.
It's analyzing for itself whether it needs to perform CPR. And while it's doing that, it does not want you to touch the patient.
Shock advised.
It's telling you that it does need to give a shot. It could have said no shot needed, but it needs to charge it first to give a shot.
Stay clear of patient.
It wants to make sure you stay clear.
Deliver shock now. Press the orange button now.
And you press the orange button to give a shot.
Begin CPR.
And then now it's telling you to do CPR. Now technically, the AED was utilized correct. Now, is this the correct way to perform the AED? No, not at all. You probably like, this is new stuff. He didn't do nothing but just chill. This must be that 2024 CPR. No, that's not how we do it. So let me explain what I mean. She gets to go. Here's the problem. Fun fact. There's a rule. My laptop's still on. Okay, it's still on. Cool. If you are more than, hold on, I can't see that it's still on. There we go. Yeah, it's still on. Okay. There's a rule that a lot of people know about. That's very important. And let me explain. First thing, let's backtrack. When you are giving compressions, you are pumping blood throughout the body. When you are breathing, you're breathing oxygen into the body. Let me go into a little bit of anatomy and explain that. I did my bachelor's and master's in kinesiology, so I love anatomy and biomechanics. You do not just need blood circulating to live. You need oxygenated blood circulating. So people gotta understand there's two travel systems in your body. There's only two. Your nervous system, that sends electrical signals, and your blood, that sends everything else. If I need to get protein from here, I'm a meathead, so of course I use that analogy. If I need to get protein from here to here, it's gonna go through the blood. The blood pushes. So what happens is your blood is pushing oxygenated blood throughout the body all day, every day. When you stop breathing and you fall out, at that point you were breathing at one point in time. So that's why as soon as we get there, we do compressions. We're trying to push the rest of that oxygenated blood around the body. But then we now got to put fresh oxygen in. That's why you get to breath. Now let's pump that blood around the body. That's all we're doing. So that's kind of how this concept works. Now I'm going to sidetrack to an analogy. Imagine if I had a pump. Boom, boom, boom. There's a pump with a tube. Tube got water in it. I start pumping. I'm pumping and water's going up that tube. What happens once I stop pumping? What happens to the water? It goes back down. Boom. If you understand that analogy, we're good. If you don't, shit. So, if that tube went all the way up to this high ceiling, if I was pumping and then I stopped, but I only stopped for a brief second, I can catch that water before it gets all the way down to basement. But if I wait too long, it gets all the way back down to basement. It's almost like you're starting all the way over. It technically is. That's kind of working on it. I'm not participating because I'm not gonna get in trouble if somebody, you guys kill this person. So you'll be by yourself with the AED. Let's roll over here. So just go right into your compressions. And then as soon as the AED arrives, you start utilizing the AED. I got the AED. Yep, you can stop and go right to the AED. Hey, there you go to veteran. Hey, veteran. You assuming. Let the AED tell you what to do. iPhone. Stay clear of the patient. You gotta make sure you stay clear and swing that arm out. First, there's a couple of reasons why. Let me get to the most important reason why. Because if you don't, you won't pass the class. And you waste 3 hours with it. So that's the most important reason why. But the second thing is, everything we do, I don't know if you guys notice, we have a backup plan. Meaning, when you check the breath, you're also watching to see if the chest rises. That's your backup plan. When you're blowing into their mouth, you're still watching to see the chest rise up. That's your backup plan to make sure you're doing it right. If you say clear, maybe keep in mind, somebody go out, somebody's dying. People are probably freaking out. There might be a chance that whoever's helping you is just so zoned out. They're there helping, but they're zoned out. So when you say clear, they didn't hear you. That's the reason why you do the arm swing. Or you might do the arm swing and they're so focused, you know, if you would have yelled clear, they would have heard you, but you didn't yell clear, you just did the arm swing. Now you're hitting them, they're in the middle of something, maybe something got knocked over. Both of those are like reassuring the other component. So you want to make sure that you're yelling out clear and swinging your arm out while you're at it. Now I'm going to get into the bag mask. The bag mask, this is going to be the most technique-driven component of the course. What the bag mask is it's going to be a way of giving breath. So let me jump on over here for you. There's going to be something called a C and E clamp technique. We're going to talk about this in a second. The C is your thumb and your index. You look like your game man. The last 3 fingers is going to be your E, still look like your game man. So your C is going to hold the north and the south of the mask and push it down into the face. Your E is going to go underneath the chin and tip the head. So what that means, you're going to be completely over the head. Your C, north and south, pushing the mask down. Not squeezing the mask, pushing it straight down to the face. Last 3 fingers are going to form the E, and that's going to tip the head back. And with that being said, you're going to be able to 2 breaths and watch it see if the chest rises. Let's come on to the front. We utilize our bag mask. Remember your C, your thumb and your index got to be over the head. Come over. And then your E, get that middle finger under the chin also, and tip the head back. And once you push that
index finger of one hand and press down on the dome of the mask toward the face to further seal the rim of the mask. The remaining 3 fingers of that same hand should form an E to reach past the edge of the mask along the bony rim of the jaw. To tilt the head back, lift the jaw toward the mask and open the airway.
Make sure you squeeze the mask with your thumb and index finger while lifting the jaw to achieve an airtight seal between the mask and the face. And squeeze the bag with your other hand or push it against your leg or body. If the chest doesn't rise with each breath, you're not providing adequate breaths. If you don't get chest rise, readjust the mask, reposition the head and neck, and try again to ventilate. And then, only if necessary, administer a larger amount of air, just enough to get chest rise.
The critical points of delivering breaths remain the same for the bag mask device as for the pocket mask. 2 breaths are given, with each breath given over 1 second after every set of 30 compressions. Be sure to deliver each breath over 1 second with just enough volume to make the chest rise. Delivering breaths in this way will reduce the chance of gastric inflation, or air going into the person's stomach instead of the lungs. Gastric inflation can cause vomiting and possible aspiration.
If you have multiple rescuers, the most effective way to deliver breaths with the bag mask device is to use the 2-person technique. One rescuer focuses on keeping the airway open and securing the mask, while a second rescuer squeezes the bag to deliver breaths, just enough to cause the chest to rise. The first rescuer will use both hands to seal the mask to the person's face and lift the jaw. The thumbs and index fingers of both hands each form a C to seal the mask against the face, and the 3 remaining fingers of each hand will form an E for lifting both sides of the jaw into the mask. Be careful not to press too hard on the mask, which could push the jaw down and block the airway.
Now it's time to practice the 1 rescuer bag mask technique so that in a few minutes we can combine it with compressions to create a 2 rescuer sequence. We'll pause here to get into position.
Alright, let's give it another go now. That should make more sense now that you've seen it. Let's rock and roll. Just the back mask. Seeing E-clamp technique right over the head. Took the head back. Thin part. Good. Good. That's what I'm talking about. Alright, come back up. We good?
Sometimes treatment for a cardiac arrest may be delayed, either because of barriers to accessing the victim or because the arrest was not witnessed. Regardless, CPR is still critical.
The earlier a victim of cardiac arrest receives CPR and shock delivery, the greater the chance of survival and recovery. And early CPR has been shown to double or even triple survival from witnessed sudden cardiac arrest.
For many healthcare providers and other rescuers, the 2-person or team rescue is a more common occurrence. So let's first look at the roles for 2-person rescues.
The first rescuer should begin CPR with chest compressions while counting out loud and delivering breaths. Basically, they're handling the situation at first as a 1 rescuer scenario. The second rescuer is responsible for powering up the AED and attaching the pads, as well as providing ventilation when a device becomes available. It's important to remember that the rescuer performing compressions should switch roles about every 2 minutes to avoid fatigue and ensure that compressions remain effective. The compressor should pause when ventilations are being given until an advanced airway is secured. The compressor may also need to briefly pause when the advanced airway is inserted. And if you're performing CPR without an AED, you should switch roles when fatigued, or after every 5 cycles. That's about every 2 minutes. When an AED is present, switch roles every time the AED tells you to reanalyze, or sooner if the compressor is fatigued. This switch should take less than 5 seconds to minimize interruptions in chest compressions. We'll learn more about how to effectively switch roles in the team dynamics section.
In 2 rescuer CPR, each rescuer has a specific role. Let's review these roles while watching them play out. Rescuer number 1 should be positioned at the person's side, ready to perform chest compressions and count them out loud. And rescuer number 2 should be positioned at the person's head. It's rescuer 2's role to maintain an open airway and give breaths with a bag mask device while watching for the chest to rise and avoiding excessive ventilation. Rescuer 2 should also encourage rescuer 1 to perform chest compressions that are fast and deep enough and allow complete chest recoil between compressions.
Now let's practice 2 rescuer BLS. Follow the video as you practice. We'll work on the full sequence, from the point of finding the victim until advanced medical help arrives. We'll pause here for you to get into position for the 2 rescuer practice.
Alright, so here's the deal. Very straightforward. I'm not going to give any guidance on this. I want you guys to experience what it's like to work with a partner. So with that being said, the only thing I'm going to tell you right now is that somebody just fell out on the floor and they need CPR. They are over there. You need to go through your scene assessment, compressions, breaths. I will let you will tell me to get the AED. I will let you know when the AED arrives. Other than that, good luck. I hope this person lives. They're down here, just dying. Take your time. But y'all explain to the mamas. They don't make it. Are you okay? Call 911. You need the AED. I'll get the AED. I'll let you know when it arrives. So what's your partner doing? There you go. Uh-oh, we're on the side of it. We're not on the front of it no more. Uh-oh, we give a breath while we're pressing. We still not on the front of it though. There you go, now we're on the front. Has it been 10 seconds? Remember that rule. Uh-oh, we got time out like there you go. Was that 30 compressions? We're not counting out loud no more. I got the AED.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Apply pads. Plug in connector. Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient.
Here.
Deliver shock now. Press the orange button now. Shock delivered. Begin CPR.
A little slower. Here we go. Just keep that okay. There you go. Mask is upside down. Cool. Okay. How do you guys think you did?
He was up in B.
You yourself a B. What'd you get? You said bad. So what letter is bad? A D. Okay. Here's the deal. Very transparently, most people do bad. And let me tell you why. And to be honest with you, I don't give guidance because I want you to realize that you're going to do bad. Let me explain. If I was to teach you guys up front how to work as a because there's literally a skill that comes with working with a partner. Now, here's the funny thing. When I tell you what this skill is, it's going to sound trivial, which is why I like you guys to experience working as a partner first before I go over this. Communication. You have to communicate with your partner. Now, both of you two seem like you both are quiet people in life. That's fine. I'm quiet when I'm alone. But I want to remind you guys, somebody's dying. This is not the time to be quiet. You got to speak up. When you are working with a partner, they don't know what you're thinking, you don't know what they're thinking. Case in point, she probably was standing up thinking, what am I doing? You jumped in with right to scene assessment and compression, so she was like, my man about to rock this whole thing. Oh, he that person that want to get the project done next week. He don't want to wait till next year. Because you didn't tell her, all right, I'm going to do this, you're going to do that. You could have told her. And all right, we're going there, you're going to do this, I'm going to do that. So now she's sitting here wondering, what am I going to do? You trying to put the AED pads on. You didn't communicate with them, hey, I'm put the pads on, and you move to the side. So now y'all bumping into each other trying to put the pads on. All of those things could have been resolved just by doing one thing. Talk. That's it. Just talk. So what I'm going to do, rock, paper, scissors, please. I go again.
Alright, rock, paper, scissors, shoot. Like rock, paper, scissors, shoot. Rock, paper, scissors, shoot. There you go.
Okay, cool.
Guys.
You go. All right. Me and you are gonna go. We're gonna knock this out again. All I want you to notice is I want to do one thing here. Communicate. We may still make mistakes. Mistakes can be made. Mistakes probably will be made because nobody wakes up at 9 a.m. in the morning and call Advocate Christ Hospital and be like, hey, it's 9 a.m. I'm thinking around 12 p.m. I'm going cardiac arrest. I see you guys then. It doesn't work like that where you're prepared. So mistakes are gonna happen. But that communication will alleviate a lot of those mistakes. So we're gonna go again. Come on back up. She will be the one giving us the AED. We don't need the AED until we go through one full cycle of compressions and breaths. Please. So you can take all that with you. And what I want you to notice, the big thing I want you guys to notice is this. I'm not allowing you to wonder what I'm thinking. I always tell people, CPR, you're looking at my best advice, think out loud. Unless you're thinking, damn, I wish I wasn't here right now. You can keep that to yourself. But other than that, think out loud when you give me CPR so the other person doesn't have to assume this is what we're doing, this is what I'm doing, this is what we're doing. There should be no assuming. If everybody speaks out loud, we're good. So it's not just about correcting somebody, it's like literally just announcing everything you do. So nevertheless, you got this person down. Look, I'm going to go ahead and take care of scene assessment compression. Can you do breath and AED when it arrives? All right. Scene to say, are you okay? You okay? Pulse. I got no pulse. Please, lady in the blue, can you call 911 and get an AED and start CPR? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. Make sure you're overhead. 5, 6, 7, 8, 29, 30. 2 breaths. 1 breath is good. Breath is good. Going back to pressures. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. AED is a wrap. You take over the AED. I'll take over the rest. 7, 8, 9, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. I'm taking over the rest. I'm going back to the pressures. 1, 2. Let me know if you need me to move. 6, 7, 8. Move. Yep. Resuming compressions.
Analyzing heart rhythm. Do not touch the patient.
Clear.
Shock.
Resuming compressions.
Charging. Stay clear of the patient.
Clear.
Deliver shock now.
Can you take over compressions after shocks? Good.
Shock delivery. Begin CPR.
Good. That's it. We're good. So literally, it's that easy. It's just communicating all of your thoughts. I don't allow them to guess, assume, wonder. That's all you gotta do. That will make the difference with CPR. Just communicate. But nevertheless, come on back up.
CPR. This means that you may need to give mouth-to-mouth breaths without a pocket mask or bag mask device. Although we won't practice this, it may be a skill you'll need to use one day. This section shows how to give mouth-to-mouth breaths when a barrier device isn't available.
Mouth-to-mouth breathing is a quick and effective way to provide oxygen to a victim. Each breath you take contains about 21% oxygen. When you provide a rescue breath, that breath contains about 17% oxygen. This is why rescue breaths are effective in providing oxygen.
Let's go through the steps to deliver mouth-to-mouth breaths. Start by holding the person's airway open with a head tilt chin lift. With your hand on the forehead, use your thumb and index finger to pinch the nose closed.
Now, take a regular breath and seal your lips around the person's mouth, creating an airtight seal. Give one breath, blowing for about 1 second. Watch for the chest to rise as you give the breath. If the chest doesn't rise, repeat the head tilt chin lift. Give a second breath, blowing for 1 second while watching for the chest to rise. If you can't ventilate the person after 2 attempts, check for an airway obstruction, but then promptly return to chest compressions. Make sure you give each breath over 1 second and deliver air just until you make the person's chest rise.
Today, we've looked mostly at the procedures you should perform when someone does not have a pulse. But you should also know what to do if someone has a pulse but is not breathing effectively. When that happens, rescuers should give breaths without chest compressions. This is known as rescue breathing. For adults, give 1 rescue breath every 6 seconds. Also, give each breath over 1 second and make sure that each breath results in visible chest rise. During rescue breathing, you should also check the person's pulse about every 2 minutes.
Alright. Going over. So, what I want to cover, I'll turn this back on, is rescue breath. So, what rescue breath does basically is first off, it's a very unique situation because the person has a pulse, they're just not breathing, which is kind of some zombie apocalypse type stuff. Usually one comes to the other. So, usually what I always tell people is somebody has a pulse but they're not breathing. And anatomically, we're not built to work like that, meaning biomechanically, by anatomy of life, if you have a pulse, you're breathing. It's the only, real not to say the only way, but one of the main ways you can alter that is with drugs. That's what drugs do. Drugs alter things. All drugs do. You know, if you got a cold, you take drugs to alter the symptoms. You don't want to sneeze. You don't want to have snot coming out, so you take a drug. That's all drugs do is alter your body's normal. Well,
medications used primarily for pain relief. In high doses, these medications can cause a person to stop breathing or can even cause death. Naloxone is a medication that can reverse the effects of opioids and may restore normal breathing. Common ways to give naloxone are intravenous, intramuscular, and intranasal. If you suspect an opioid-associated life-threatening emergency in an adult who is unresponsive and isn't breathing normally but has a pulse, you should give one rescue breath every 6 seconds. Then, if your local protocol allows, give naloxone, but do not delay breaths to give naloxone. If the person does not have a pulse, you may give naloxone after starting CPR, but do not delay compressions. For further information on opioid-associated life-threatening emergencies, please consult your provider manual.
Treating cardiac arrest in someone who's pregnant can come with heightened anxiety because 2 lives are at stake. In addition, some rescuers may be unfamiliar with handling the visible anatomy of a pregnant woman. The best outcome for both the mother and the baby depends on BLS rescuers summoning help, providing high-quality CPR, and using an AED without delay. Compressions, ventilation, and AED use are mostly unchanged. If the abdomen is visibly rounded and additional help is available, rescuers should manually displace the rounded abdomen to the mother's left side during compressions to help with blood flow to the heart. More information is available in your provider manual.
So really, I think Janine is going to push what we have to say.
Yeah. Oh yeah.
What you are about to see will include the portrayal of advanced life support skills. As a BLS provider, you may be on a team with advanced life support providers, but rest assured, those skills are not part of this training. However, no matter the skill, procedure, or equipment used in a resuscitation event, BLS must continue.
Successful teams not only have medical expertise and mastery of resuscitation skills, but they also practice good communication skills and adhere to the key elements of effective team dynamics. Team dynamics is an element of high-performance teams and can be broken down into 3 categories: roles and responsibilities, what to communicate, and how to communicate.
Clear roles and responsibilities should be immediately established by the team leader or the first rescuer on the scene. When all team members know their roles and responsibilities during a resuscitation attempt, the team functions smoothly.
The ideal situation is when multiple rescuers work as a team to perform all the needed roles in a resuscitation attempt. This figure identifies 6 possible team roles for a resuscitation. Note that some roles are typically performed by advanced providers. If enough rescuers are present, each rescuer takes a role. If the team has fewer than 6 rescuers, some team members may be assigned more than one role. Some roles have a higher priority than others.
The compressor assesses the victim and stays next to the victim's chest to perform chest compressions. When giving compressions, rescuers should switch compressors after every 5 cycles of CPR, about every 2 minutes, or sooner if tired.
The rescuer positioned by the victim's head maintains an open airway and delivers breaths while watching for chest rise and avoiding excessive ventilation.
The team member operating the AED or the monitor defibrillator can also serve as the CPR coach. The role of the CPR coach is to focus on team members' performance of high-quality CPR and to provide feedback as needed during the resuscitation attempt.
Every resuscitation team must have a defined leader who assigns roles and makes treatment decisions. Often, the team leader will be at the foot of the victim. However, the team leader may move around to observe and evaluate the skills of the team and to provide feedback when needed.
The timer recorder keeps a record of the events that occur, including frequency and duration of interruptions and chest compressions, time of shock delivery, and medication administration. When only 2 rescuers are present, they typically take the roles of compressor and airway, with one of them also covering monitor defibrillator and team leader. If 3 rescuers are present, they take positions around the victim in the 3 critical roles: compressor, monitor defibrillator.
Every member of the team should know his or her limitations. Team members should ask for assistance and advice early, not when the situation deteriorates.
I'm getting pretty tired of these compressors. I'm getting sick of after this.
Sometimes a team member or the team leader may need to correct actions that are incorrect or inappropriate. It's important to be tactful, especially if you need to correct a colleague before they make a mistake.
The next category is what to communicate. Knowledge sharing and summarizing information are critical components of effective team performance. Team leaders should review what's happened and ask for ideas and observations from team members.
That's our second shot. We have 1 milligram, we're gonna be on board.
Okay, starting in another 2 minutes.
About liking.
Okay, 100 milligrams of lidocaine. The last category is how to communicate. Closed-loop communication is the process of verifying that the message sent was received as intended. It also verifies that any assigned tasks have been completed.
This is our first round of CPR. We have 1 shot on board.
Go one shot on board.
In addition to using closed-loop communication, teams should use clear messaging to help prevent misunderstandings. Teams that work together frequently can create terms or phrases that have specific meaning for them to ensure clarity among members.
So when I'm ready to intubate, what I want you to do is pull that mask off, but keep it handy in case I happen to miss.
Finally, teams need to communicate with respect. Speak to each other in a professional manner, regardless of scope of practice or expertise. Resuscitation events are stressful and emotions can run high. Understand that this is the nature of CPR and remain focused on the life you're trying to save.
A high-performing team achieves specific performance metrics, including a high chest compression fraction, or CCF. CCF is the amount of time spent doing high-quality chest compressions during a cardiac arrest resuscitation attempt. You can only achieve a high CCF by eliminating pauses during high-quality CPR.
The Resuscitation Outcomes Consortium trials, or ROC trials, show that a 10% increase in CCF is roughly equal to an 11% increase in survival. Pauses typically occur during intubation, rhythm analysis, pulse checks, compressor switches, and defibrillation. We'll address some best practices for eliminating pauses in some of these areas, but you'll also need to measure high-quality CPR metrics at your own place of practice to identify other areas where pauses exist. You cannot improve what you do not measure.
Whenever compressions are paused, compressors should hover their hands over the chest and be prepared to resume compressions.
As a BLS provider, you may notice that advanced providers check for a pulse, pre-charge the defibrillator, and prepare to deliver a shock about 15 seconds before pausing compressions at the end of each 2-minute cycle. When using an AED, the prompts will instruct you when to pause. For example, during rhythm analysis or shock delivery.
Switch compressors with the second compressor coming in from behind the first. This allows the second compressor to have the same view of the team, and in particular, of the AED or defibrillator. For seamless transitions, switching between cycles every 2 minutes is best. However, if a compressor needs to switch because of fatigue, coordinate the switch to happen as fluidly as possible, such as while delivering breaths.
Soft CPR, switch. Shocking, everybody clear? Shock, go.
It's a best practice to use real-time feedback devices during CPR. However, if a feedback device isn't available, a metronome can help establish the proper rate.
So does anybody need to go to the washroom before we head to child? Which is the next thing. Good? Good? Cool. Alright, so if you like me, you probably think, well, this is your first time, you looking at the clock like, bro, it's like an hour and a half, we just get to child. No worries. Child is like 10% of what it does. Because most of the things that we do in adult, we also do for child. So all you gotta do is quickly learn about the little differences and then we can practice that.
Now that we've covered adult BLS, let's discuss BLS for children. It may be difficult to imagine a child being a victim of cardiac arrest, but it certainly happens. Pediatric cardiac arrest isn't as common as adult cardiac arrest. In adults, the cause of cardiac arrest is often cardiac related, but in children and infants, cardiac arrest is often due to respiratory problems, such as airway obstruction, drowning, opioid overdose, or seizures.
There are some differences in BLS for children, including the chains of survival. Like the adult chains of survival, the pediatric chains have 6 links. Both pediatric chains include prevention of cardiac arrest, activation of the emergency response system, high-quality CPR, advanced resuscitation, post-cardiac arrest care, and recovery. In a hospital setting, the difference is the first link. It focuses on early recognition and prevention of cardiac arrest, which emphasizes patient monitoring and assessment.
Before we get to the practice, let's talk about a few important differences between BLS for children and BLS for adults. First, under the AHA BLS guidelines, anyone from age 1 year old to puberty is considered a child. Under these guidelines, puberty is defined as chest or underarm hair on boys and any breast development on girls. When you're performing compressions on a child, it's fine to use 1 or 2 hands, whichever works for you and allows you to provide deep, effective compressions.
To be effective, your compressions must go to a depth of at least 1/3 the depth of the child's chest. That's approximately 2 inches or 5 centimeters. And the chest must recoil completely between compressions. Also, whether the victim is a child or an adult, a single rescuer always uses a compression to ventilation ratio of 30 compressions to 2 breaths. However, if you're a 2 rescuer team and the victim is a child, the ratio changes and should be 15 compressions to 2 breaths.
It's important to note that giving breaths to children requires less volume and force than giving breaths to adults. Breaths that are too large or forceful have greater potential to cause lung trauma in children than in adults. However, you still need to provide enough air to see the chest rise.
Another difference is when to activate the emergency response system. If you do not witness the arrest and you're alone, you should perform 5 cycles of CPR to deliver oxygenated blood to the victim's brain before you activate the emergency response system. If the child has an adequate pulse but is not breathing normally, it may be due to a respiratory problem, so you must provide rescue breaths. Deliver 1 breath every 2 to 3 seconds or 20 to 30 breaths per minute.
If you are alone and witness a sudden arrest, leave the child so that you can activate the emergency response system and get the AED. Then return to the child to perform CPR and use the AED.
Now, let's combine the BLS skills that you've learned for adults with the differences we just reviewed to practice BLS for children. For this session, we'll practice 2 rescuer child CPR by using a 15 to 2 compression to ventilation ratio. One person will provide compressions while the other delivers breaths with a bag mask device. We'll pause here while everyone gets into position.
Alright, so that's literally the only difference between adult and child. We're already past that. So here's the deal though. When we go with child, there's some slight differences. The differences are going to be the compression of breath ratio when 2 people are involved is 15 to 2. Now I want to remind everybody that's only when 2 people are involved. If you're by yourself, it's still 30 to 2. Also, you now have an option to utilize 2 different compression methods. You can do with both hands over the chest, push it straight down, or you can do 1 hand if you choose to. Keep in they'll give communicate and not hurt, then they'll hover their hand over while this person is giving breath so they can immediately start back over. I know it's done with good intent. The idea is that you can get back impressions quicker, but you're blocking this person's visualization to see if the breath went up. And also you might be possibly pushing down the chest and not realizing. The other component that's going to be different is the AED. The pads are different. Now, I did not instruct you guys on how to use the AED pads for a child. I'm not going to instruct you guys on how to use the AED pads for a child. The reason being is, if you treat the AED just like I said, it's your first time and you're just listening to it and you're reading what it tells you to do, you'll be fine. So, I shouldn't have to. So, with that being said, you're going to work as a team again. Remember, communicate. You got 6 sets of compression and breath. I'll notify you when the AED arrives. Let's roll. Full thing, yep.
You go get the AED on 911.
I'll go get it for you.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
I got the AED.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Plug in pads connector next to flashing light.
Got it. Really got to work on talk. Over the head, over the head, over the head, over the head. When you give a rest, you should be over the head.
Do not touch the
You
patient.
plug the pads in. Pads got it on the chest. You assume. Listen to the AED.
Apply pads. Plug in connector.
Good.
Apply pads. Plug in connector.
Good.
Pour onto the heart rhythm.
Pressures.
Do not touch the patient.
Clear.
Shock advised.
Pressures.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Deliver shock now. Press the orange button now. Shock delivered.
All right. Come on up. So same principles apply. Make sure you get compression throughout most of it. Communicate, telling y'all, make a break. It's something that doesn't matter. Here's the thing. I know it's you want to go to past class. I get that. But what you don't practice here, you want to do in real life. It might be it might not be serious until you're the one in that position and then somebody dies because of something lackluster like that. And trust me, the most eyeballs people
Here's a
that's taking this class has ended up in that situation. Usually not somebody at work. Most of the time it's like somebody at home fell out. And if somebody dies off of something primitive like that, gotta live with that information for the rest of your life.
fact about cardiac arrest. Between 75 and 80% of all out-of-hospital cardiac arrests happen at home. So being trained to perform CPR, whatever your profession, can be the difference in saving a loved one. And we never know who a victim might be. Cardiac arrest can occur in anyone, regardless of their age or perceived health.
Rescuing an infant can feel completely different from rescuing an adult, but the principles of CPR for infants who are younger than 1 year old are essentially the same as for adults. There are just a few differences, but those differences are significant.
So let's take things in the same order we use for adult CPR. Right now, we'll talk about the skills for 1 rescuer and 2 rescuer infant CPR. But this time, we'll first learn to check for a brachial pulse. Then we'll cover infant compressions, followed by giving breaths with a bag mask device. Finally, we'll combine all of these to practice 2 rescuer infant CPR.
First, if the cardiac arrest is witnessed 2 minutes of compressions and breathing before activating emergency response, if it hasn't already been activated.
If an infant has an adequate pulse but isn't breathing normally, rescue breaths may be required. Deliver 1 breath every 2 to 3 seconds, which is about 20 to 30 breaths per minute. To check an infant's brachial pulse, first place 2 or 3 fingers on the inside of the upper arm, between the elbow and shoulder. Then, press your index and middle fingers gently against the inside of the upper arm for at least 5 seconds, and no more than 10 seconds. If there is no pulse, or if the heart rate is less than 60 per minute with signs of poor perfusion despite adequate oxygenation, begin CPR.
To begin CPR, there are 2 options for hand and finger placement when performing compressions on an infant. The first technique is to place the tips of your 2 fingers on the sternum or breastbone in the center of the infant's chest just below the nipple line, but be careful not to press on the bottom of the breastbone.
The other is the 2-thumb encircling hands technique. Place both thumbs side by side in the center of the infant's chest on the lower half of the breastbone. In very small infants, your thumbs may overlap. Don't apply any pressure on the tip of the breastbone. Now, encircle the infant's chest and support the back with the fingers of both of your hands. In this position, both thumbs will be used to depress the breastbone.
Whether using the 2-finger or 2-thumb encircling hands technique, once in the correct position, push hard and fast to a depth of at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters. And the rate needs to be at least 100 to 120 compressions per minute. After each compression, allow the chest to recoil completely.
As we get ready to practice infant chest compressions, remember these key points. Deliver compressions at the rate of 100 to 120 per minute. Make sure the depth of the compressions is at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters. Allow the chest to completely recoil after each compression, and count out loud as you deliver 30 compressions. So, let's get into position to practice compressions.
Alright, so come on over. So now we're back to infant now. When it comes to compressions, there used to be a situation where you would either do 2 fingers on the side if you were by yourself, or if you had a partner, you would 2 thumbs here at the base. Now you literally have the option to do either one. Most people are just choosing 2 thumbs. The reason why is, I can tell you the reason why this was an issue. This was an issue because if you did 2 thumbs by yourself, let's say you had a back mass, that means you would have to do this, get all the way up, come all the way over to the top of the head, get down to 2 breaths, get all the way up, come back to the base. You were gonna get exhausted. It wasn't a realistic thing. So, but 2 fingers, you're on the side, you can slide over to 2 breaths. But the problem with 2 fingers is, it's just less efficient than 2 thumbs. 2 thumbs is just easier, it's better. So now you have that option, even if you're by yourself, you can do 2 thumbs. So with this being said, we're just gonna practice the 2-thumb technique. All you're doing, you're at the base, 1, 2, 3, 4, 5, 6, all the way up to 30. See what you got. First. Nope. Right into the questions. Good. Now don't forget to count out loud. Next.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Good. Yeah, they skipped past the assessment component of it as far as practicing it, but I'll cover it a little bit later once we get past breaths.
This is similar to the adult bag mask technique we practiced earlier. 2 things to note before you start. 1, make sure you have the right size mask so that it isn't too big or too small. And 2, remember that chest rise is the most observable sign to determine the effectiveness of your rescue breaths.
First, position yourself directly above the infant's head. You'll use the EC clamp technique that you learned earlier. But be aware that if you tilt or extend an infant's head beyond the neutral position, the infant's airway may become blocked.
Ensure a tight seal between the mask and the infant's face, and squeeze the bag with your other hand to deliver just enough breath over 1 second to make the chest rise. If the chest does not rise, then you're not providing adequate breaths. Adjust the mask, reposition the head and neck, or administer a larger amount of air.
Now, let's practice 5 sets of 2 breaths. Deliver each breath over 1 second. Deliver just enough breath to make the chest rise, and make sure you have a tight enough seal with the mask on the infant's face. We'll pause here while everyone gets into position.
Alright, come on over. Alright, so when it comes to breath, same thing applies. Bag mask, the same concept. It's a thinner bag though. Keep in mind you have a thinner mouthpiece. Everything else still applies. Back, right over the head, tip the head back. Now you don't gotta go as far back as you would for an adult or a child. You still tip the head back. Still do 2 breaths. Nope, just over the head.
So the child you do if you're using 2 people would be
15 to 2.
corrections of that to this.
Yep. Child and infant both are 15 to 2. You by yourself. See if you got it. Video, come over the head. There you go. And tilt the head just a little bit back. Push down. Good. All right. Come on back up.
Now it's time to practice 2 rescuer infant CPR. But before we begin, let's note a couple of differences between 1 rescuer and 2 rescuer infant CPR. One difference is the hand and finger placement for giving compressions. In 2 rescuer CPR, the person doing compressions should always use the 2-thumb encircling hands technique.
The other key difference between 1 rescuer and 2 rescuer infant CPR is the compression to ventilation ratio. As mentioned before, instead of a 30 to 2 ratio in a 1 rescuer situation, 2 rescuers should use the ratio of 15 compressions to 2 breaths. So let's practice compressions for 2 rescuer CPR. As a reminder, make sure your rate is between 100 to 120 compressions per minute. Use the 15 to 2 compression to ventilation ratio because you have 2 rescuers. Make the compressions approximately 1.5 inches or 4 centimeters deep. Allow the chest to fully recoil after each compression and count out loud for your partner.
Time to practice 2 rescuer infant CPR, starting with scene assessment. We will pause here while you get into position with the mannequins.
Now we're back to scene assessment. So when it comes to infant, scene assessment is a little bit different. So of course you're going to approach the scene. You still make sure it's safe for you to be in. At that point, you're going to tap feet. Hey, you okay? You okay? You're going to check halfway between the elbow
for children younger than 8 years of age? If it does, use them. If not, use the adult pads, but make sure that they do not touch or overlap. But never use the child pads for an adult. The shock dose delivered by child pads is too small for an adult and likely won't be successful. It's better to provide high-quality CPR than attempt to shock an adult with child pads. Some AED pads recommend placing one pad on the chest and one pad on the back for infants and children. Follow the pictures on the pad packages for proper placement.
If an infant needs defibrillation, a manual defibrillator is preferred. But as we mentioned before, this device is quite different from an AED, and it requires special training that is not included in this course. If a manual defibrillator is not available, an AED with a pediatric dose attenuator is preferred. But if neither is available, you may use an AED without a pediatric dose attenuator.
When food or other items block a person's airway, choking occurs. In a severe airway obstruction, the person usually has signs of poor air exchange and breathing difficulty, such as a silent cough, an inability to speak or breathe, or cyanosis, that is, turning blue. Adults or older children who are choking may clutch their neck with both hands, making the universal choking sign. If someone indicates that they are choking and cannot talk, you must act. For someone who is standing, you'll perform an abdominal thrust.
To perform an abdominal thrust, stand or kneel behind the person and place your arms around the waist. With one hand, locate the navel. Then make a fist with your other hand and place the thumb side of your fist against the person's abdomen, just above the navel and below the breastbone. Grasp your fist with the other hand and press your fist into the abdomen with a quick, forceful upward thrust. Repeat thrust until the object is expelled from the airway or the person becomes unresponsive.
If you can't wrap your arms around the waist because the person is pregnant or overweight or simply can't stand, wrap your arms around their chest and give chest thrusts instead of abdominal thrusts.
If you're not able to relieve choking in an adult or child, or if the person becomes unresponsive, have someone activate the emergency response system. Then lower the person to the ground and begin CPR.
Perform CPR as usual, but with one difference. Each time you open the airway to give breaths, look for the obstructing object in the back of the throat. If you see an object that can be easily removed, carefully remove it. But do not perform a blind finger sweep because this may cause the object to become lodged farther back in the airway.
Choking is also a fairly common emergency in infants. The steps to relieve choking in an infant are quite different from
Even harder. Yep. Flip the infant over. Yep. And then check to see if you can retrieve. Good. Pass the baby. Don't forget to support that head. It's still a baby now. There you go. Flip the infant. Good. And then check to see if you can retrieve. Perfect. Thank you. That's a happy baby. Yeah, I had a lot of babies. Why you had a lot of babies? You said you had a lot of babies?
No.
I don't
They
think
like
like,
bruises.
oh yeah, you beat the hell out of this baby. I always think about like having this like sit on my porch on Halloween out front. I think that'd freak people
As
out.
with an adult, if a choking infant becomes unresponsive, shout for help and have someone activate the emergency response system. Then, lay the infant face up on a hard, flat surface. You'll perform CPR as usual, but with one difference. Each time you open the airway to give breaths, look for the object.
To give breaths for an infant, the mouth-to-mouth and nose technique is preferred. For this technique, you will first open the infant's airway with a head tilt chin lift. Then, place your mouth over the infant's mouth and nose to create an airtight seal. Give one breath, blowing for about 1 second. Watch for the chest to rise as you give the breath. If the chest does not rise, repeat the head tilt chin lift to reopen the airway and try to give a breath that makes the chest rise. If you cannot cover the infant's mouth and nose with your mouth, use the mouth-to-mouth technique instead. The mouth-to-mouth technique for an infant is the same as for an adult.
If you can see the object, carefully try to remove it. Never perform a blind finger sweep. You should only try to remove an object if you can see it. If you're alone, after about 2 minutes or 5 cycles of CPR, activate the emergency response system. We'll pause here while you get into position to practice with the infant mannequins.
Alright, come on over. So keep in mind, let me explain this situation again. 'Cause this is a new setting. Basically, sum it up, the baby was choking, making choking sounds and all that good stuff. And then the sound stopped. So keep in mind, that means this baby now went from choking to not responsive. So now, even though whatever's had them choking is still there, the situation is now upgrading itself to this child is not breathing at all. So at that point, it becomes a CPR situation with a little bit of choking at the end. So you're going to go through your regular CPR motions, and then at the end, you're going to see if you can retrieve the item. Now, I always have at least one person ask me, like, hey, but if we're giving breath to the infant, aren't we blowing what's in there further down? Truthfully, it's possible. Truthfully, I don't care. The pen here. So we'll do that after. So come on out. I'll show you. You're just basically gonna head past the front desk. There's two tables out there. Just past the front desk for a pen and you get it. Yep. All right. See what you got. Don't be scared. I got you. All right. You start.
Hey, are you okay? You get the AD and call 911.
Will do.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
I got the AED.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Apply pads. Plug in connector. Apply.
1, 2,
Do not
3,
touch the patient.
clear.
Shock advised.
1, 2, 3, 4, 5, 6, 7, 8,
Stay clear
9,
of patient.
clear.
Deliver shock now. Shock
Good.
delivered.
Same thing. Open book. You're allowed to get 4 wrong, 25 questions. When you pass the front desk, ask for a pen. You got 30 minutes. Make sure you bring your phone and your purse with you, but come on back over here and get it. And that's how you get it done, Allison. That's funny. By the way, yes, I know that he gave compressions at the base of the body when he was skills testing. I plan on bringing that up. Do I got gray hair? Other than that, that's it. That's the show. That's the show.